Welcome, everybody. Good morning or good afternoon, wherever you are in the world. Thank you for being online with us. I'm looking at everybody that's in this camera right now, and again, we have this live audience here. And I just want to let you know that this is an MS Views and News program. We are providing programs primarily in rural and underserved communities around the United States. And yes, we are in Orlando, but does that mean that they're getting all the information that they might be getting in New York City or LA or elsewhere? Probably not, which is why we chose this area to do this program today. So, again, this is an MS Views and News program. Our guest speaker is from Salt Lake City. We do want to thank Banner Life Sciences for sponsoring today's program, so you can all give them a round of applause and thank them for doing this. Thank you. We also had exhibitors outside today from Novartis, Genentech, Janssen, and Banner, of course. And so, we do want to thank them for being part of our program, to be here and be able to provide resources to those that are in attendance. And for anybody that is online that wants to know more about those products as well, you can just write to us and we'll give you the direct links to those people. So today, again, we have our guest, Katrina Bowden. She's a nurse practitioner. She was born and raised in Utah and graduated with her bachelor's degree in nursing from the University of Utah in 2006. Katrina worked as healthcare in Health South Rehabilitation Hospital in 2008 when she began working as an infusion and multiple sclerosis nurse at the Rocky Mountain MS Clinic. Her love of caring for MS patients inspired her to pursue higher education, and Katrina graduated with a master's of Science in Nursing, Family Nurse Practitioner degree from Westminster College in 2015. Katrina has enjoyed her transition at the Rocky Mountain MS Center from being an RN to a nurse practitioner. And Katrina is an active member of the International Organization of MSRNs, which is also known as the IOMSN. And for those that are in the local area, you would know of nurse practitioners that are part of the IOMSN, Connie Easterling, Patricia Pagnotta. It's that same large organization, and Katrina's part of that as well. So Katrina's going to be speaking with you all today about disease progression, shared decision-making, MS fatigue, pain, cognition, swallowing, and speech, emerging therapies, including the title sponsors, medication, and biosimilars. So let's welcome up Katrina, and just know that after she presents, we will do the Q&A. So you all have pens, all right? And anybody online, I'm sure you have a pen somewhere in your home, all right? And I'm sure you have paper there too, and you all have paper. Write down your questions, so that way when she is done with her presentation, we'll begin the Q&A. Please know that when I go around the room, inside this room, if you have a question to ask, I'm going to need you to put on a face mask or hold up your napkin, all right? And you're not going to get to hold the microphone. Only I am going to hold the microphone. And so you're going to be speaking into the mic through your face mask or through your napkin, okay? And this way everybody will be safe. It's not always about COVID, everybody. As I said, I have a sinus infection or I have something else, and it's not COVID, but I did catch something somewhere. So it'll protect you and it'll protect me. Katrina, come on up. Thank you. Yes. Thank you.
Hi, guys. I'm so excited to be here and see faces, and then also excited for the folks online. Thank you again to Banner Life Sciences and to MS Views and News for having me here today. A little bit about myself before I get into this presentation that I did write and create myself. So I first started working at a rehabilitation hospital in 2003. Now, when I was working in a rehab hospital, I was working with folks that had multiple sclerosis that had such bad MS relapses, they required inpatient hospitalization before they could get well enough to go home. So physical therapy, occupational therapy, they got all of the services there that they needed. And I don't know if any of you in the room have had a relapse that's that bad that you end up going into the hospital. But that was my view of MS, was that it's this very debilitating disease, and it was in 2003, and we didn't have very many treatment options for MS at that time. Then in 2008, an infusion job fell into my lap at an MS clinic, and I took it, and I said, okay, sure. And I started working there as an infusion nurse. And then within a few months, I became an MS certified nurse. And then I became a nurse educator, and then continued my way up until I got my master's degree. And it was my love of MS that led me to get a master's degree. And I've had a few patients say, well, how can you love MS? How can you love this disease? It's because we have things we can do to help you, and it is a lifelong chronic illness. And there is always something to be learned and always something to be done. And I am a helper. I want to help people. And so I'm always educating myself about what I can do to help my people with multiple sclerosis. And yes, I did start working when I was 12. And so nice to meet you all, and I'm going to get started. So this is called Living Your Best Life with Multiple Sclerosis. When I sit down with people who are newly diagnosed with MS and we're talking about what can we do to help you, these are a bunch of my tips and tricks. So first off, we need to dispel a few myths. Number one, your doctor and your provider does not know everything. They don't know everything about MS. They don't know everything about the rest of your life. And they don't know everything about the rest of your health. And not all providers are created equal. If you're meeting with a provider and you don't feel comfortable with what they're telling you, get another opinion. Also, if you're meeting with your provider and they are not listening to you, there's not shared decision making, you don't have an input, let's get another opinion. Also, it's very, very important that you share with me, if I'm your provider, what are your concerns? How can we make the best decision together? What else is going on in your life? When I'm choosing a medicine to treat your MS, all of these things are important to me. Also, you need to find somebody that you can work with in one way or another. They listen to you, they have a good team, and those are your people. And then you need to know the right questions to ask. Unfortunately, we don't have time to get to everything. And so if you know the right questions to ask, it can help guide our conversation. So you need to advocate for yourself. Know your MRI. I hope that everybody in this room that has multiple sclerosis has seen their MRI. If they haven't, I would encourage you to get a disc of your MRI, take it in to your next appointment, and say to your provider, hey, can we look at my MRI? What does my MRI look like? What does this tell me about my multiple sclerosis? So there's different types of MRIs. So you know you're in that machine for a very, very long time. What we're doing is getting different views or different pictures of your brain and your spinal cord. Now the MRI is a magnet. So based on what slices they're doing, we can get an overall look at your MS. So the first is your T2 lesions. That's your total number of scars. So multiple sclerosis means many lesions or many scars. So your T2 is the total count. Now, multiple sclerosis is an autoimmune disease where your body's own immune system sees some part of your body as foreign and attacks it. And in multiple sclerosis, that is the myelin, which is the protective coating of your neurons in your central nervous system. It sees it as foreign and it attacks it and it breaks it down. That causes inflammation and swelling, which causes more inflammation, which causes the scars of the multiple sclerosis. So T2, again, is your total number of lesions. So if you say, well, how many lesions do I have? We would count that on T2. Then, you know, you're in that MRI and you're in there and it's going, and then they pull you out and they say, okay, we're going to put an IV in and we're going to put gadolinium in. And you might feel a little weird hot flush and they put that gadolinium in and they shoot you back in the machine. What we're looking at there is active lesions. So gadolinium is this metal that if we put it into a bloodstream, it's too large of a molecule to actually cross the blood-brain barrier and do anything. Well, when you're having an active MS attack, what happens is that blood-brain barrier gets a little bit more open because it's calling those immune cells through to fight what it thinks is an infection, but it's really not. It's your myelin. Now, when that blood-brain barrier gets open and it's calling those cells through, it can also pull that gadolinium with it. So those lesions will light up or look different on an MRI, a GAD enhancing lesion. So if you have a gadolinium enhancing lesion, that tells me that your MS is under active attack right at that moment. Now, a few things with that. Some people think that only an active lesion can cause symptoms. That's not the case at all. And some people think that their MS is in complete remission and they don't need to take medicine to treat their MS if their lesions aren't enhancing. That's also not true. So when you talk to your provider about what does my MRI look like, we have our T2 lesions, which is our total number of lesions. So if you get a call from your provider and they say your MRI is stable with no new or enhancing lesions, that means when they took this MRI that they just did compared to your last MRI 6 months ago, 3 months ago, a year ago, whatever it may be, and they put it side by side, they look exactly the same. Or they may say, hey, you have 2 new T2 lesions, but they're not showing enhancement. That means that they're older than about a month old, but they're newer than your last MRI. I also encourage people to make sure that they have MRIs frequently. Now, when I first started treating MS, we used to say, okay, you get an MRI, and then that was kind of it. You were diagnosed and they didn't continue monitoring. Luckily, that has changed. So in my practice, I recommend that you have an MRI at diagnosis anytime you have new symptoms, 6 months after starting a new disease-modifying therapy, and if you're completely stable, every year after that. That might feel like a lot, but it's very important that we know what's going on. The reason for that is new lesions can occur about 5 to 10 times more frequently than new symptoms. So even if you feel okay, if your MRI looks different or there's been a change, you're probably going to get a phone call from your provider saying, hey, maybe we need to change what we're doing because your MRI is telling us something different than what you're feeling. So multiple sclerosis can affect the central nervous system. So the central nervous system is comprised of your brain, your cervical spinal cord, and your thoracic spinal cord. So lesions may occur in any of those places. So this is an MRI of the cervical spine looking at lesions in the cervical spine. Now you may notice that it's different than your brain. I once had somebody explain it to me that your brain is much bigger. It's like a 6-lane highway. And you may develop lesions on your brain that you never even have symptoms of. If you're driving on a 6-lane highway and there's an accident on that far left-hand side, but you're in the right-hand lane, you might get super lucky and zoom past that accident and not even feel it. You may not be in traffic at all. That's like a brain lesion. Or unfortunately, if the brain lesion occurs on the right-hand lane and you're in the right-hand lane, we're going to get caught in traffic. You're going to have symptoms of that. Now, think about spinal cord lesions as a 2-lane highway. If there is an accident on a 2-lane highway, you may get stuck in that accident and you may be in traffic for a long time. That can happen with lesions in the spinal cord. People tend to feel the lesions a lot more. I said that for a long time, feel lesions. And I was doing a program once and somebody said, so you mean I feel it like right here? Like I'll feel it? No, you would have the symptom of the lesion. So what are some possible symptoms of multiple sclerosis? You may notice there are a lot of different symptoms. And MS, some of you may have heard, is a snowflake disease. Everybody's MS is different, just like every snowflake or your fingerprint. Everybody's multiple sclerosis is different. Your symptoms may be silent, meaning nobody can see them, but you feel them. They may also be more physical with a limp or trouble walking. It might be difficulty with your bladder. It might be fatigue, depression. Multiple sclerosis can affect any part of your central nervous system, and you can have any of the symptoms from it, and everybody is different. I'm yet to have one patient that has the exact same symptoms as another patient, and at our clinic, we take care of 4,500 people that have multiple sclerosis. So a few other things. Advocate for yourself. Could your symptoms be from something other than multiple sclerosis? Now, you have multiple sclerosis, which means you have an autoimmune disease, but you also may be human because we're all human, and humans may have something else going on. For example, high blood pressure can cause fatigue, headaches, and dizziness. If you have a very high blood pressure and we're dealing with hypertension, it doesn't matter how good we are at treating your MS, you're probably going to have a headache. So to help that headache get better, let's get your blood pressure down, and then you're going to get feeling better. Also, cord compression can cause numbness or weakness. I have this patient who's near and dear to my heart. She'd been wheelchair bound for years. She'd had MS since the 80s. And it was the early 2000s. And so everybody just blamed all of her weakness on multiple sclerosis. Well, she was having a real difficulty moving her arm. And everyone assumed, oh, that's just MS. Well, then a brilliant practitioner said, hey, let's do a neck MRI. Let's see what's going on. She had such a bad bulging disc, it was compressing her spinal cord. Sent her to neurosurgery. She had that fixed, and she came into clinic and said, I'm moving my arm for the first time in 20 years. Because it was all assumed it was from multiple sclerosis. So always ask the question, could something else be causing this symptom? Also, pelvic floor weakness can cause incontinence. You might think, oh, this MS is making my bladder leak, but there might be something else going on that a physical therapist could really help with. So always ask the question, is something else going on? Is there something else I can do about this? And if so, who do I see? Also, educate yourself. You did not choose to have multiple sclerosis. You did not choose to get an autoimmune disease. So you should receive the benefits of having an autoimmune disease, such as a Golden Parks Pass. So just because you carry the diagnosis of multiple sclerosis, you can get into any national park for free in the US for the rest of your lifetime. Do I want you to go to national parks? Please do. Absolutely. Ask your provider. You can look online how you can get a national parks pass, and then take your family with you in the car so everybody gets in for free, so you get that benefit. Also, if you have difficulty preparing your own meals, you may qualify for things like Meals on Wheels or food delivery. There are also transportation grants. There are amazing foundations out there to help people that have multiple sclerosis. I have some patients that use a grant through a foundation, and their transportation to and from my office for all of their treatments is 100% free and covered by that grant. And with gas being so expensive these days, that might be something worth looking into. Also, get a handicap parking pass. I've had some people say, well, I look fine. I feel guilty using that handicap parking pass. Well, as many of you that have multiple sclerosis know, the more you walk, the more tired your legs are. So let's say you go to that college football game and you get that parking spot that's 2 miles away and you're walking with everybody else. You might not be able to get into the event. Or if you do, your legs might be so tired that then you can't enjoy the game. Use that parking pass. Now, if you're going to the grocery store and there's a spot up close and you want to save that parking spot in case somebody else needs it, fine. But use that parking pass. Use what's available to you so you're not expending all of your energy getting where you need to go. Also, exercise and support groups. Many are available online now, like Stuart was saying here with MS Views and News. You can get online on YouTube. You can follow with exercise. There's yoga and so many other things available to you to help keep yourself good and healthy. Also, there are services through pharmaceutical companies. I always tell my patients that have multiple sclerosis, don't let your MS be a financial burden. Your MS medicine should be covered, or you should get copay assistance or a grant or something for your medicine. And sometimes it's a matter of just calling the pharmaceutical company that makes your medicine and saying, hey, what do I qualify for? Do I qualify for free drug? Do I qualify for copay assistance? What can I do to make sure that my medicine is not a financial burden? Also, there are grants for cooling devices, for MRIs, for wheelchair ramps. Sometimes it does take a little bit of effort, you picking up the phone and calling different foundations, different support groups, and finding out what's available to you. I've had patients get air conditioning units installed in their homes for free, wheelchair ramps installed for free, laptops covered, cooling devices covered. You just have to ask the question. And then also scholarships for school. If you have multiple sclerosis, you may qualify for a grant through one of the societies. Or if you're a child of somebody that has multiple sclerosis, you may qualify for a grant for school. We have one patient in our clinic that has multiple sclerosis, and much of her education was covered through grants through a nonprofit for multiple sclerosis. Find out what's available to you. Also, advocate for yourself. As providers, we live in a world of butterflies and roses. And if you come into our office and you say everything is fine, I'm going to assume you are also in a world of butterflies and roses. But if not, keep a running list of questions. The likelihood is, if you have questions, those are probably things that I want to get to in my visit as well. So when I sit down for my visits, I always say, what is on your list to talk about today? And then we'll get to everything on my list to talk about. That helps a couple things. That helps me know how you're doing. Your questions will tell me how you're doing with your MS. Also, it helps me pace the appointment. Do we have 25 things to talk about? Do we have 3 things to talk about? And it helps guide and make sure that you have all of your questions answered. Now, if there's too many questions, we may say, hey, let's make another appointment for a couple weeks from now. Let's make sure we address everything now so that we can make sure all of your needs are taken care of. Now, keeping that running list should not only be your list, it should be your family members' list. So what is your care partner and your support system? What are their questions? Some people have a note section in their phone where they write those questions down. Some people have journals or pads they write it down, or a whiteboard at home that they write those questions down. And make sure you're seeing your provider enough that all of your questions get answered. So here are some questions to think about. What can I expect from a disease-modifying therapy? Why am I taking this medication? When I worked in the inpatient hospital, I would walk into patients' rooms and I would pop open their pills and I would say, okay, here's your lisinopril, it's for blood pressure. Here's this, it's for cholesterol. Here's this, it's for muscle spasms. And people would say, oh my gosh, I didn't even know why I was taking that medication. It's very important to know why you're taking that medication. And in this world of amazing MS treatments, you may have less symptomatic medication or you may have more symptomatic medication. Why are you taking this medicine? What is it helping with? When I treat MS, I have my must-haves and my may-haves. A must-have for me is treating the underlying disease. A may-have is treating the symptoms. So let's talk about what your must-haves and your may-haves are. Also, what do my MRI studies tell me and my provider? What does the contrast mean? What does my MRI look like? Are there any risks or side effects of this medicine? And also, are there any risks and side effects of my multiple sclerosis? What about my other conditions and medications? What's causing what? What are the costs associated with this treatment? Where are the resources in my community, and how do I find out about those? And where can I go to learn about my disease? Back to that, I started working with folks with MS in 2003 when we didn't have very many options. We now have so many different options. And where can you learn about all of these? We have over 22 FDA-approved disease-modifying therapies. We're getting a lot better at treating MS as we go along. When I started working in MS, a nurse said to me, this is a really good time to have MS. And I was offended. I said, why would it be a really good time to have a chronic autoimmune disease? And now I understand. There are so many options and resources available and lots of money going into research for MS. So if you're going to have a chronic autoimmune disease, right now is a good time to have it because there's so much more that can be done. Learn the common MS terminology. Sometimes we don't speak human in healthcare, so I do my best to speak human. So a Lermite sign. So you may have one of your providers say, do you ever have a Lermite? So a Lermite sign is when you bend your head forward and you get electric shocks up and down your spine or numbness tingling in your extremities. That might be telling me that you have a lesion going on in your cervical or your thoracic spinal cord. Some people that have multiple sclerosis have that symptom all day, every day. For some people, it's really their thermometer. It tells them how their MS is doing. They only get those shocks if their MS is acting up. Some people never have it. But it's important to know if that's something that's going on with you. And then what is Uthoff's phenomenon and what can I do about it? So we're here in Florida today. It's hot. When people that have multiple sclerosis, when their core body temperature overheats, all of their MS symptoms get worse. This was coined after Professor Uthoff. He was in the 1890s and he did this hot bath test. He recognized that people had something going on with their nervous system. So he would put them in a hot bath, and then when they got out, they couldn't walk. So those of you in the room that have MS may know, if I get overheated, if I sit at that soccer game for too long, I can't walk to my car after. Or if I'm sitting in the sun, all of my MS symptoms get worse. My folks that are runners will say, gosh, when I start running, all of a sudden my eye gets blurred and my leg starts to drag. You're not doing your MS harm. Your central nervous system is just overheated, and we need to cool that down. So the way to treat that UTOF phenomenon is by getting your core body temperature cool. Whether that's cooling vests, cooling towels, cooling fans, little cooling things around your neck, whatever we can do to keep yourself cool. That's also important because if you have symptoms of a relapse, so by definition, a multiple sclerosis relapse is a new or worsening symptom that lasts 24 hours or greater in the absence of illness, infection, or other trigger. The reason we have that caveat is, let's say you have a rip-roaring UTI, but because you have multiple sclerosis, you're not having the burning in frequency that you might have had before you had MS. You have decreased sensation. So your leg gets weak, you're super tired, and you can't get out of bed. So you call me and you say, I'm having a relapse. The first thing I'm going to say is, do you have an infection? And if not, let's check for a UTI. I saw somebody just the other week who said, oh my gosh, I've been wiped out for 3 weeks. I'm certain I'm having a relapse. And I said, all right, let's just screen and do a UA just to make sure you don't have a UTI. Well, they had a UTI. We treat the infection, the core body temperature goes down, and the MS symptoms get better. That's called a pseudo-relapse. So UTOF's phenomenon can oftentimes mimic a pseudo-relapse. I'm going to go back to that. Could these symptoms be from something other than multiple sclerosis? A patient called our clinic the other day, said, I have such bad fatigue. I'm sure it's an MS relapse. This person's in their 70s. And one of the nurse practitioners said, I'm feeling nervous about this. You should probably go in and get checked for an infection. Just fatigue is your only symptom. Well, I also felt a little dizzy. I thought I was going to vomit the other day. Yeah, let's go ahead and get you checked out for an infection. The patient was having a heart attack. But they blamed MS because they were tired. But luckily, the nurse practitioner said, let's make sure we get you checked out. Let's send you into the urgent care. They hooked up the EKG. They were having a heart attack. Thank heavens we didn't treat for an MS relapse. Thank heavens they're admitted to the hospital being treated for a heart attack. So pay attention to your body and your symptoms and ask questions. And then learn the difference in your MRI lesions and what symptoms your lesions are causing in particular. When people say, hey, can we look at my lesions on my MRI? I'll show them, and then we'll talk about what possible symptoms those lesions could be contributing to. And then learn about the different medications used to treat MS. What are the side effects of each and every medication you're being prescribed? Sometimes you may say, oh my gosh, I'm so tired. It must be my MS. Well, it's a side effect of one of the meds that you're taking. So maybe we need to change medication change one of your symptomatic medications before we change your MS medication. Also know if the medication is being used to treat a symptom of MS or the underlying disease itself. And then how do you know if your medication is working or not? So if you get prescribed a new medication, you should say to your provider, how do I know if this is working? How long do I take it until I know it's working? If I have side effects, when will the side effects occur? Will the side effects get better? Will they get worse? And how do I know? So we have a handful of goals when we treat multiple sclerosis. The first is with disease-modifying therapies. That's treating the underlying problem itself. Unfortunately, we don't have a cure for MS yet. So when we're treating multiple sclerosis, we are trying to delay the progression of multiple sclerosis. Remember, it's an autoimmune disease. So your immune system wants to go ahead and just keep on attacking that myelin. So our goal is to delay that from happening, prevent the relapses, and prevent progression on MRI. Again, we have many disease-modifying therapies to do that, and I'm about to get to that. And then we also treat the symptoms of multiple sclerosis. Now remember, new symptoms can occur without new lesions. Old lesions can cause new symptoms. And on the flip side, new lesions can occur without new symptoms. And unfortunately, we don't have an FDA-approved medication to repair lesions yet. So our goal is prevention. One of the hardest things for me as a provider is having to tell people, I cannot fix what has been done. I cannot undo what has been done. I can only prevent it as best we can. Sometimes people say, well, I don't want to treat my MS yet because I'm not having symptoms of it, so I'm just going to keep waiting. And then 10 years later, they come in and it's too late. They have a lesion that's in their spinal cord that has affected their ability to walk, and I can't undo it. I can't fix it. So please, please talk to your prescribers about taking medication to delay the progression of multiple sclerosis and prevent the lesions from occurring. Now, how can new symptoms occur without new lesions? This is a great question. Dr. Steven Krieger, I make no money on this. He's a neurologist out of New York, and he has, it's called the topographical model of multiple sclerosis. You can look it up on the internet. He has a whole interactive thing, Dr. Steven Krieger's topographical model of MS. But he really puts a picture to how you can develop new symptoms without new lesions. So he describes the central nervous system as a pool of water. The shallow end of the pool is your optic nerve and your spinal cord, and the deep end of the pool is the bigger parts of your brain. Now, lesions are like coral down in that water, or columns down in that water. Now, if you developed a lesion in 1995 in the big part of your brain, and you didn't have a symptom from it, it was below the water level. So if you're a skier skiing across that water, you don't feel that coral. You're not hitting that at all. It's below the water level. It's below the clinical threshold. Now that lesion that occurred in 1995, unfortunately, as we age, everybody's brain shrinks and everybody's water level goes down with time. Now, people with multiple sclerosis, unfortunately, that happens at a more rapid rate than people that don't have MS. And untreated folks with MS, that can happen even more rapidly. So then, fast forward, it's 2022, you have a lesion from 1995. It's now above the water level. So if you're a skier skiing across the water, now you're going to hit that lesion. You're going to have a symptom from that lesion that you didn't have before. So that's how old lesions can cause new symptoms, and why we want to try and prevent those lesions from occurring in the first place. Also, that water level may drop very quickly if you have an infection or if you're having an active MS relapse. So again, I take no credit for that. That's Dr. Steven Krieger's topographical model of MS, and you can look that up. So back to that, I started treating MS when I was 12. We only had a few medications. Now, this list was so long, and I adapted this from the MS Society, I had to make the typing very small because we have so many FDA-approved disease-modifying therapies to treat multiple sclerosis. Now, one takeaway from this is I hope that there is a medicine for everyone. They all work differently. Some are similar, some are different from each other. There are different classes of MS. We have pills, we have shots, and we have infusible medications. They're dosed different frequency, times. There's different side effects to each one of them. And I hope that each of you in this room that have multiple sclerosis and each of you online can find one that works for you. Now, this pandemic thing has been happening. And so a lot of folks don't know that in the past few years, MS is still trucking along, and we have even more new medications out to treat MS in just the past 2 years. We have Kesimpta, that's a once-a-month shot. We have generic dimethyl fumarate, which is similar to Tecfidera. We have Zeposia, a pill, Bifiratem, a twice-a-day pill, and Ponvory, a pill. So just in the past 2 years, we have these new medications to treat MS. So one thing about generics. Generic medication can be really great if it is affordable for you. Now, I've been dealing with this a lot in our clinic. We had a lot of folks on Tecfidera, and unfortunately, when it went generic, their insurance forced them onto a generic formulation. Now, generic medication, and there are plenty of patients that are on generic Copaxone, and it's going fantastically. I have other people that when Copaxone went generic, they couldn't tolerate it or started having side effects that they never had to their medication before. So generic medications can be FDA approved, and they can have a 10% bioavailability swing either way. So it might be 10% more potent or 10% less potent, and that's okay per the FDA. So if you're going to the pharmacy and you're getting Advil, but you get generic ibuprofen, depending on who that manufacturer is in that bottle, it might be a little 10% more potent than your regular Advil or 10% less potent. And for medicine like Advil or acetaminophen, Tylenol, that's okay. But for MS medication, for some people that causes a real problem if their body is sensitive to those side effects. Also, they make it a different manufacturer every month. So this month you get something that's very similar to the brand name. The next month you get something that's 10% more potent, and the next month it's something that's 10% less potent. That's a 20% swing, and that can cause a lot of problems. Now, if you're on a generic formulation of a medication and it is affordable for you with a $0 copay and you're not having side effects, beautiful. Stay on that medication. However, if you go on a generic medication and you go, all of a sudden I'm having side effects, this medicine I never had before, then that's worth talking to your provider about possibly changing medication. One beautiful thing about branded medications is that we know you're getting the same dose of the same medicine every single time you put it in your body. It is coming out of the same manufacturing plant. It's the same potency. It should act the same every single time you put it in your body. Also, one nice thing about branded medicines versus generic medicines is a branded medicine goes through a pharmaceutical company so you can get copay assistance. This goes for seizure medicine. This goes for heart medication, and this goes for MS medication. If you're getting a branded medicine, and let's say your insurance covers 80%, but you have a 20% copay, which ends up being $300 a month, you can call the pharmaceutical company and say, do you have any copay assistance available for this medication? Do you have any free drug program? Is there a way for me to get this medication and have it be more financially viable? I have some people on symptomatic medication that they're branded, but it's too expensive for them. Their insurance doesn't cover it well. So they get free drug from the pharmaceutical company. I have the same thing with MS medication. If you're on Bifurtim and you cannot afford your copay, you call Banner Life Sciences and you say, do you have any copay assistance available? And then they say, why, yes, we do. We can pick that up for you. So it should be $0 per month. But a lot of these companies can't offer that. You have to ask the question. So find out what MS medication you're on, what pharmaceutical company is making it, and then you call them. They all have a 1-800 number. You call them and you say, do you have any copay assistance available to me? You can also ask, do you have any pharmacists available to talk to me? Do you have any nurses? Do you have any case managers? There are many things available to you through these pharmaceutical companies that can really help with your overall multiple sclerosis. And there's more medications coming out and being studied and even more new classes to treat MS. It's a very exciting time. So then let's talk about symptom improvement without medication. Because up to this point, you might be like, man, Katrina's a pill pusher. I'm actually not. I back to my must-haves and my may-haves. You will get a real beady-eyed stare from me about being on an MS medication. But you won't get a beady-eyed stare from me about being on symptomatic medication. And the reason I say that is there are many naturopathic things we can do to help symptoms. So let's talk about those. So spasticity. So spasticity can be a handful of things. For some people, it's a cramp that's super painful and tightness in their calf, but it only lasts for a little while and then it lets go. Or it might be tightness, and when you walk, you find that you're more tight and bouncy. So what are some things we can do about spasticity other than taking a muscle relaxer, which may have side effects associated with it? By the way, I'm sorry for those online. I'm trying to talk to the people in the room for a second. I see so many people taking notes, and I'm so happy right now. I'm so proud of you guys for advocating for yourself, for your multiple sclerosis. I love it. Okay, now I'll continue. So stretching. Stretching can be a great thing. There's a reason there's yoga for MS. There's a reason there's Pilates for MS. Stretching those muscles can make a huge difference. If you're spastic all the time and you're tight all the time and you're never stretching those muscles out, they're going to stay tight. So if spasticity is a thing for you, make it part of your early morning routine and your bedtime routine. You get out of the bed, you sit on the edge, you stand up, you stretch your legs in the bed, you get down, you stretch on the floor, you go side to side, stretch before you get into bed, and then stretch when you get out of the bed. Also, I have a handful of folks that swear by apple cider vinegar before they go to bed. Now, make sure to dilute it, unless you're one of those people that just likes to shoot apple cider vinegar. But if you Google apple cider vinegar for spasticity, there's even a recipe on there with honey, water, and apple cider vinegar. And I have a lot of folks that say, you know what, it really helps my spasticity. If I do that before bedtime, I'm not waking up in the middle of the night with muscle cramps. Also, Epsom salt soaks or lotions. That helps with the alkalinity in your body and can really help. Now, remember, I said Utah's phenomenon, people getting into hot baths. So when I say a soak, that might be a warm bath that you're soaking in with Epsom salts, or it can be part of your nightly routine that you fill up either your tub or a little tub of warm water and soak your feet in those Epsom salts. If you're one of those people that get cramps in your feet at night, that can really help. And then over-the-counter magnesium. I'm going to talk about magnesium as we go along a little bit more, but magnesium can be really awesome. We use magnesium all the time for migraine prevention, works well for muscle spasticity, and the most common side effect of magnesium is diarrhea. So if you're one of those people that has multiple sclerosis, that you're constipated all the time, magnesium can be a beautiful kill two birds with one stone. So it can treat your spasticity. And also, rather than giving you diarrhea, it can just help your stools be more frequent and softer. And so I have a lot of folks that really like magnesium. Also, sleep. A lot of folks with multiple sclerosis have insomnia. So what are some things we can do about sleep? Go to bed and wake up at the same time every day. Our body has an internal clock. And if we tell that clock we're going to the bed at the same time every day and we're waking up at the same time every day, it will listen. Now that's hard because, there are sometimes you may want to stay up late or wake up in the morning. But if you train your body to go to bed at the same time every day and wake up at the same time every day, it makes a huge difference. I unfortunately have hereditary chronic migraines. And I found that if I go to bed at the same time every day and wake up at the same time every day, I have way less migraines. So I promise I practice what I preach there. Also, keep your room cool. If you're getting overheated at night, you're going to be sweating, you're going to be waking up, you have wet sheets, you're not able to be comfortable. So keep your room cool. That can help improve your sleep. So there are cooling sheets that are available, cooling mattresses, cooling towels, cooling blankets, a fan right on your face, whatever you can do to keep cool. Also, don't look at screens an hour before bedtime. We used to tell people don't have a TV in your room and don't watch TV before bedtime. Well, now we have the TV available in our hands, and so we're looking at our phone, and then we turn it off and think we're going to go right to sleep. Nope. An hour before bedtime, no TV. Your bed should be for two things, sex and sleep. And so you're also not in your bed looking at your phone. If you're going to be up in your phone, you're going to be in your living room looking at your phone. Once you go to your bed, that phone is off. And you can read, you can talk to your care partner, you can call and talk to somebody on the phone, you can do word puzzles on paper. Paper still does exist. Not your phone. The screen in your phone is going to stimulate you and make your body want to stay awake. Try relaxation techniques or guided imagery. When I was pregnant, I had horrible migraines and I could not sleep for the life of me. So a nurse practitioner said, well, have you tried guided imagery for sleep? And I was like, what type of mumbo jumbo is this? But okay. So if you get on YouTube, and here's my exception, you can turn the YouTube on and then turn your phone upside down so then it's just talking to you. And there's guided imagery and relaxation things that you can do to help you fall asleep. Also, there's apps out there, Calm, Relax Melodies, other things that can really help walk you through falling asleep. And then your phone turns off when you're asleep and then you go to bed. And it worked fantastically. It's how I treated sleep when I was pregnant. Also have a bedtime routine. Those of you that have kids in the room, you may recall your pediatrician when your kids were little and their kids didn't want to go to sleep at night. They'd say, have a bedtime routine. Again, it trains the brain and the body that it's time to go to bed. So do the same thing every night and we'll help you fall asleep. And then there are some people that really like sleepy time teas or warm milk and honey before bed. Those things are natural and can help you as well. So what about pain? I'm going to sound like a broken record when I talk about hydration. Hydrate, hydrate, hydrate. Water is H2O, hydrogen, and oxygen. Just hydration itself can help flush out oxidants, flush out bad things in your body and antioxidant properties. So flush out any of those bad toxins, that have built up in your muscles. Exercise. Exercise can help prevent pain. Again, guided imagery or meditation. And massage. If you have muscle tightness and pain is one of your big problems, massage can make a world of difference. I wish we had a way to make massage free, but we don't. So if you can afford massage, please do it. Or buy one of those massage guns online. They have such cool things now that you can reach back and massage your own back or your own legs. And then if you have trouble walking, physical therapy can be an amazing thing. Also, an assistive device. Do you need walking sticks, walking poles, a walker, maybe an AFO or other orthotics like a Bioness might help your gait improve. How about depression? More than half of people that have multiple sclerosis have depression. Therapy can be a beautiful thing. And in this world of the pandemic with things being available online, you might just do your therapy 100% online. You might not even have to leave your house and have it all be over Zoom. Also, enjoy a hobby. A hobby can really help improve depression. Join a support group. And it's okay to ask for help. It is okay to ask for help. Also, positive thoughts, wellness training, meditation, and mindfulness. Now, this is another thing I'm stealing from another neurologist, so I give him 100% credit. Dr. Kotry. He's treated MS for over 40 years, and he wrote a book called Healing the Soul. So I might be butchering this story, so if you want to know the exact story, you'd have to read it in his book. But he tells about a patient that had multiple sclerosis that was not doing well. Their MRIs were getting worse. Gait was getting worse. Everything was getting worse. And there was an experimental medication. So they enrolled in the trial, and it was a double-blind, double placebo trial. Well, this patient got on the medicine and started doing fantastically well. MRIs got better. They ditched their cane. They started participating in hobbies, being an advocacy part of groups. They went to the FDA and said, we need to get this medication approved because it's life-changing and amazing. So long story short, at the end of the trial, when the physicians were able to see whether the patient was getting the medication or placebo, and they became unblinded, he opened it up and saw that patient was on placebo the whole time. So he called them and said, I need to tell you, you've been on placebo. I can get you on the real drug when it's FDA approved, but you've been on placebo. And he said there was a pause. And the patient said, well, I guess that goes to show the power of positive thinking. If you're going to do well, and you tell yourself you're going to do well, you're going to do well. I have a lovely patient that is near and dear to my heart. She's one of the most amazing humans on the planet. And unfortunately, MS has been very unkind to her body. And she is in a wheelchair full time and lives in a care facility. Well, she's the resident president at her care facility. And she requires a lift to get in and out of bed. She requires assistance to do everything. But every day she gets up, she puts on her clothes, does her hair, puts on makeup, and puts on perfume. And people will say, well, why do you do that? And she said, well, why not? Here I am alive, and I can help other people, and keeps a positive attitude. If you're going to do well and tell yourself you're going to do well, you're going to do great. Constipation, eat foods high in fiber. I've talked to people about, okay, you have constipation. What are you eating during the day? Meat and potatoes, ma'am. All right, what's green? Nothing green. Okay, we need to start with green things. If you don't like eating the green things, can we juice something? Can we make a smoothie? How can we sneak some foods with fiber in there? Also, if you don't like eating the fiber, you can buy things like Metamucil or Citrusel. You can mix it with water. If you don't like the flavor of them, get the capsule form, and then hydrate to help with constipation. Your body's going to use that water. And it will pull it out of your gut because your muscles need it, your heart needs it, your bloodstream needs it. So then your poop will get hard. So if you're hydrating more water can be in your gut and can help things go through easier. Also, try to go to the bathroom at the same time every day. Train your bowels that at 9 a.m. I get up, I drink my coffee, and then I sit on the toilet. And then your body knows, okay, yeah, this is when I'm going to go. One of my GI specialist friends said, make a date with your toilet. at the same time every day. They know you're coming, you know you're coming, and your gut knows it's coming. So then you can sit down and go to the bathroom. The same goes for bladder and for urinary dysfunction. So the bladder is actually a really complicated organ. A bunch of things have to happen to go pee. So our bladder sphincter has to relax, and then our bladder muscles have to contract at the same time. Now, when you have multiple sclerosis and you have those lesions and disruptions in the pathway, one of those lesions may get lost. One of those signals may get lost in translation because of the lesion. And so maybe your muscle's relaxing, but the bladder's not contracting. So you're dribbling out just a little, but it's not coming all the way out. Or maybe it's contracting, but then the muscle isn't relaxing. So then you're having bladder spasms. So normal bladder function is quite a complex process. And people that have multiple sclerosis, there's many places in that pathway where that can get disrupted. So what can we do to help that? You got to hydrate. That bladder wall needs to have the stimulation from the water. So also urinate every 2 hours. And you're going to say, lady, you are freaking crazy if you think I'm going to go to the bathroom every 2 hours. I promise you, if you do it, just like when you're bladder training when you're a kid, your bladder knows every 2 hours I'm going to get emptied. So I can go ahead and fill, and I know in 2 hours I'm going to go into that bathroom, I'm going to see that toilet, I'm going to empty it. So you're not getting that constant feeling of I've got to go, I've got to go, I've got to go. Also, train your bladder. When you sit on the toilet, you are emptying it all the way. You sit down and you relax. You let that sphincter relax. You let that bladder contract. Now, if you find you're one of those people that when you stand up, you feel like you have to go right away, again, we can do something that's called double voiding. You're telling your bladder you're going to empty all the way. So you sit down on the toilet, you empty your bladder, you wiggle around, you wipe, you stand up, and then you sit back down and go again. And you're telling your body, yep, I'm going to get it all out when I'm sitting on this toilet. Also, some people find if they rub their bladder a little bit, it can help. And then also avoid food or drinks that irritate the bladder. There are a lot of foods, if you Google it, foods that irritate the bladder, you may find I am eating a lot of those, or I'm drinking a lot of that. And that might be part of the problem why your bladder is spasming, because it gets irritated and then it spasms, and then your MS goes out of control and your bladder's doing this and you feel like you have to pee all the time. Also, if you're having a really hard time, I might send you to see a urologist, and the urologist can help. There are medications that can help empty all the way. There are medications that can help with those spasms. And also, at times, you might need a catheter, but that would be the urologist that would help determine do you need a catheter or not. And then also the bladder training and the pelvic floor exercises. So there are physical therapists that their job is to help train your pelvic floor. There are many women that after they've had a baby, their pelvic floor gets weak. And so they're blaming MS for their problem, but actually it's because they had a baby and they need to do some exercises like Kegels and get that pelvic floor good and strong again, and that can help. And then again, bladder dysfunction can be very complex, and it may require evaluation by a urologist for appropriate treatment to make sure we're treating the right thing. So visual difficulties. When I was a new NP, I swear everybody that had MS had blurred vision, and I was sending everybody to ophthalmology because they had blurred vision. 98% of the time, they'd go see the ophthalmologist, and the ophthalmologist would say, you have dry eye. Now, dry eye sounds like such a simple thing, but it really can make the vision blurred. So artificial tears or lubricant eye drops can help with that. Also, if you're having visual difficulties, there's visual therapy. If you find your eyes overshooting and so you're constantly having trouble focusing on something, we have therapists that their full-time job is to help train your eyes so that they work appropriately. And then also, you might need prescription lenses like prisms or blue light, other things to help the vision. If you're dizzy, hydration can really help. Also, balance or vestibular therapy. And then it may sound silly, but stand up slowly. If you need to get up and you just jump up, there's a lot of things that have to happen there, and your blood pressure may go down, other things might happen, and you might feel dizzy, and then you go, woo, you get that head rush, and then you continue on. So if you're going to stand up and you're in your bed, okay, sit up in the bed, wiggle around, get our body oriented, then sit with our legs on the edge of the bed, wiggle around, get oriented. Take a deep breath, and then stand up. It might help so you don't get so dizzy. Fatigue. Divide large projects into smaller parts. Gather the supplies in advance of an activity like cooking or cleaning so you don't have to run around finding supplies when you complete the task. Like those cooking shows on TV, they cook food in 30 minutes and I'm like, oh, I'm going to do that. And 3 hours later, I haven't done it in 30 minutes because I had to go run and grab my measuring cups. Oh, and then I had to go get the sugar and it was over here. And I had to go get my pan and it was over here. If you look at the list, gather everything, get it all together all at once so you're not running back and forth to do things, that can help not expend your energy and improve your fatigue. Plan your shopping list in advance. So if you're one of those people that still likes to go to the grocery store, put your grocery list into sections. Okay, I have the dairy section. I have my produce. I have my bread. So then each of your things are divided. Or have your groceries delivered. Or order your groceries online and then go pick it up. That can really help maintain your energy and not expend your energy on something like grocery shopping. There are some people that find if they cook all their meals at once for the week, that really helps with their energy. Or you can buy frozen meals, healthy frozen meals that you just have to put in a pan or a crock pot to cook. That can help as well. Use wheeled carts to transport heavier items around the house. So those of you that have a walker, throw that heavy box on that walker and push it along. Or get a cart to help roll things around. Consider using adaptive devices for dressing, bathing, and household chores. Shower chairs are amazing and wonderful. If you get so tired standing up in the shower, plus you're losing your balance because you have to put your feet against the side of the shower and a hand against the wall so you're not losing balance, you're using all sorts of energy to shower. And a shower chair can be really helpful so you can sit down to shower. Keep your house cool if your fatigue tends to get worse when it's warm. You're looking at me like I'm going over on time. Am I still good? Okay. Keep your house cool if your fatigue tends to get worse when it's warm. Run a dehumidifier if your fatigue tends to flare during humid weather. And use a handicap permit and park close to the building, like I said earlier. And then again, treat the other conditions that you have as well. High cholesterol. So other conditions may worsen not only MS symptoms, but the brain volume itself. So remember how I was talking about that pool of water going down with time? That brain volume might go down with high cholesterol. High blood pressure and heart disease can lead to decreased gray matter in the brain. Obesity can increase T2-1 lesion volume. Thyroid disease is linked to decreased gray matter volume, and type 2 diabetes can decrease gray matter volume. So if you have any of these things, not only is your MS working against you, but these things are as well. So please talk to your providers about what you can do to maintain those. Treat other conditions that you have as well. And then rely on your support system. I'm sorry I didn't change this from caregiver to care partner, but support your care partner. Your people that are supporting you all the time, they probably need support as well. Whether that's mental, emotional, physical support, whether it's you understand that your care partner needs to go golfing once a week because that's how they keep themselves sane, whether it's they have a movie room or a relaxation room, whatever you can do to support them. And guess what? Ask each other. What can I do to support you? And what can I do to support you? What do you need this week? Sometimes it's 50-50, sometimes it's 80-20, sometimes we're just limping along. But if you support each other, you're going to make it. And then delegate tasks. And it's okay to ask for help. And then, so in summary, because we have Q&A, educate and advocate for yourself. Treat your symptoms of MS. Treat other conditions that you may have. And utilize the resources available to you. Okay. So now I'm going to get to questions because I think there are a few.
A person wrote in, I have CRPS in my left leg. The summer heat seems to be my left leg worst because having MS and living in Arizona, I can't do as much exercise either indoors or outside. Do you have any recommendations? I do know you spoke about it, but if you can repeat that, please.
So with the CRPS, I would actually recommend they see a pain specialist. There are some cool things that can be done, like nerve blocks or epidurals. Also, there are amazing pain creams that you can have compounded at a compounding pharmacy and put topically on the area that hurts. Also, if you're in a state where cannabis is legal for medical uses, there are topical cannabis creams that can help as well. And then also, if you find that heat is what causes a big problem, maybe get a cooling wrap to put around the area specifically that is painful.
How is it that stress can aggravate MS so badly it knocked me out of work for 3 weeks?
Yeah. So there are a handful of things about stress. So I used to say stress worsens underlying MS symptoms, but I'd say it wouldn't put you into relapse. It's just going to worsen the underlying symptoms. I now have seen people that have been under such exorbitant amounts of stress, they have new GAD-enhancing lesions on their MRIs, on really good MS medications, and we can pinpoint it back to stress. So when you're stressed, your body is in fight or flight, not in rest and digest. So when you're in fight or flight, you might be on an adrenaline thing. And so your body's ability to compensate and work around goes way, way, way down. Also, when you're stressed, your body releases stress hormones, which increase inflammation, which then can worsen your underlying MS symptoms. So although it sounds so much easier said than done, stress reduction is such an important thing. I've seen people have true horrid MS relapses going through divorce, getting new jobs, moving across the country, things like that. So if you know you have a stressful situation coming up, it's time to start doing the meditation. It's time to start doing the yoga, talking to a therapist, whatever you can do to decrease the stress, because as humans, we have stress, unfortunately, and there's no way to avoid it. So it's best if we know how to tackle it head on and figure out what it is for us that decreases the stress. Is it 15 minutes of meditation every morning? Is it yoga? Is it taking a nap? And make sure when you're stressed that you're eating well and sleeping well as well. Because when we're stressed, we tend to not sleep as well. And if you're only getting a few hours of sleep every night, back to that rest and digest, you can't have cellular replenishment and repair. So absolutely stress can knock you down. And so it's the best if we can treat the stress as best we can.
Are there any new treatment options for primary progressive on the horizon?
There are new treatments on the horizon for primary progressive. So I can't speak to them until they're officially FDA approved, but they are being studied. There's some more B-cell depleting therapies being studied. And then there's also these BTK inhibitors, which are really cool. So we'll see if they get a primary progressive label as well. But the answer is yes. There are more on the horizon.
You talked a lot about not being able to urinate or having bowel movement. What about too frequent urination and bowel movements?
So if you're going to the bathroom too frequently with urination, that 2-hour bladder training can really help. Or you might need a medication to help your bladder so you're not going so frequently. Now, the most common side effect of most of those bladder medications is constipation. So if you find that you are having diarrhea often, and urinating a lot, that bladder medication may kill two birds with one stone and help slow things up. And again, back to the bowel movement, making a date with your toilet can really help train your bowel. But then also, if you're having a lot of loose bowels, take a look at your medications and sit down with your provider and say, hey, could any of these be causing my diarrhea? There are some diabetic medications that are known for causing diarrhea, so that might be the problem. Or maybe it's a cholesterol medication, so maybe you need a medication adjustment to help with that.
Thank you. Next question from online is, I'm currently on Ocrevus infusions every 6 months, but I don't like that it knocks out my immunity, especially concerning COVID. Are there any new DMTs that do not kill the B cells?
So yes, there are new disease-modifying therapies that don't kill the B cells. So back to that screen where I went through the new MS medications, there are medications that sequester cells in the lymph nodes, So those are not killing B cells. Also, this program is sponsored by Banner Life Sciences. Their medication, monomethylfumarate, does not kill any cells. It's essentially a potent antioxidant. So yes, there are absolutely medications on the market that do not kill your B cells. So that's a question to talk to your provider about. Hey, I'm nervous about my immunity with this COVID. Are there other medication options available to me that I can use because I'm concerned about my cells being killed? Or if it is determined that that medicine is the best medicine for you, what can I do to help prevent getting infection and things like that?
Yes, I've just been recently diagnosed, and before this, like you said, every patient is different. I had a car accident, which left me with a brain injury and nerve damage and that kind of thing. But now that I've been diagnosed, what categorizes or what specifically is a new symptom? Like, what should I be looking for? Because I've had so many other things going on, it's hard for me to really understand what's MS and what's something else.
Sure. So back to that screen that I had with symptoms of multiple sclerosis. But in general, how do you tell if it's a new symptom? Ask your provider. But say, hey, I've never had numbness tingling before, and I woke up the other day and I have numbness in my fingers, and now it's moving up my hand, and now it's up to my elbow. Could this be from MS, or is this something else? Also, write down your symptoms and journal them. That will help you track. That can help you piece through what is new and what is different and what is the norm. You know, fatigue, not me, I don't have MS, but you could say, okay, fatigue is my number one symptom. Every day at 2 p.m., I'm extra tired. Okay, that's a normal underlying symptom. But let's say you get up one day and then by 10 a.m., you're like, I need to go to sleep. And then you wake up for another hour. Oh my gosh, I need to go to sleep again. Then you can look at your journal and go, okay, this is new. This is different fatigue. This is different than it was before. Also pain, track your pain. Track any symptoms that feel different. Okay, all of a sudden I'm urinating more. That can help you figure out what is a new symptom. And then you can ask your provider, hey, is this an MS symptom or is this something else? Do we need to go looking for something? Maybe you have carpal tunnel. Maybe there's something else going on that we need to look for.
Okay, thank you.
And you know your body.
Thank you. I'm back online, and we have a person asking, again, what is the name of the book you mentioned, Healing the Soul?
Yeah, Healing the Soul, Dr. Kotry.
Yes, that's
And then another book that I love is Optimal Health in Multiple Sclerosis. That one's by Dr. Alan Bowling. And again, I'd make no money on any of this. That really looks at naturopathic options for MS and things that you can do, lifestyle modifications you can make to help your MS. So that's another really good one. Yep. Optimal Health in Multiple Sclerosis by Dr. Alan Bowling.
And it's Alan, A-L-L-E-N, Bowling, like you're going bowling.
And then the other one was Healing the Soul.
Khatri is Khatri, if you're looking it up on Google. All right, so another person is asking what do you recommend for a hyperplastic bladder?
So I imagine they were probably saying hyperspastic, so it's spasming all the time, I'm guessing. Or I guess they can mean plastic and that it's getting too big, stretching out too much. So good question to talk to a urologist about, because if it's spasming, we might need an anticholinergic medication. If it's getting too large and stretching because your body's not feeling the cue to empty, that might be a matter where we either need a medication or catheter to help train that.
What's the best thing to do for leg cramps?
So that's individual for everybody. I wouldn't say there is a best thing for leg cramps, but stretching, magnesium, Epsom salt soaks, maybe lots of massage, a localized lotion or pain cream, and you might need a muscle relaxer. Sometimes muscle relaxers at night can really help just get things good and relaxed so that during the day they're not cramping so bad. Also, have your electrolytes checked. Let's make sure that there's not something going on with your potassium or your sodium that's contributing, or your calcium that's contributing to the spasming.
Great, thank you.
I'm hearing more and more that after a certain advanced age, that a lot of neurologists are not recommending to be on an MS med. Have you heard that?
So that is a concept called immune senescence, and it's being studied. But the thought behind immune senescence is, so back to multiple sclerosis being an immune system problem. As you age, your body's immune system calms down. So when you're young, in your 20s, 30s, 40s, you have a very robust immune system. And as you calm down, your immune system isn't as robust as it used to be. You might find as you get older, you're getting more infections than you did when you were younger, that it takes harder to fight those infections. So there's a thought that for some people after a certain age, their autoimmunity has shut off and they don't need MS medication anymore because we're altering the immune system too much or suppressing the immune system too much. I am a big proponent of everybody is different and everybody's circumstance is different. There are some people who have had stable MS for years and years and years and years, no MS relapses, no change in MRI, and they are able to go off of MS medication after a certain age, and they do okay. But there is not a magical age for everybody, and everybody's MS is different. So if that is a conversation that your provider has with you, then you say, okay, well, how do I monitor to be sure that going off of MS medicine is the right thing for me? And are we taking a step down in therapy? So are we going from a more potent therapy to a less potent therapy and then discontinuing completely? If we do discontinue, how often are we doing MRIs to make sure that things haven't changed? And then also physical exams. MS is not a one size fits all. So that concept is certainly going on, but do I have 78-year-olds with new enhancing lesions? Absolutely, I do. Do I have folks in their 80s on medication? Yes, I do. But we might have a conversation about what type of medication we're using in that age category and how much are we altering the immune system, because our first rule is to do no harm. So we're going to alter the immune system enough that we're not going to harm it, or do we really need to fiddle with the immune system anymore or not?
Person wants to know about fumarates. What are the differences between, they've heard of double, single, etc.? Can you explain all that?
Yeah, so as we live in this really cool age of MS medications, we're getting more and more medications in a class. So where we used to have only one medication in a class, we might have 2 or 3 or 4 in a different class. So some would put Ponvory, Mayzent, Gilenya in one class, Zeposia in one class. Then we have the fumarate class. So the class of fumarates consists of Tecfidera, dimethyl fumarate, Vumerity, and Bifurtim. So Tecfidera is dimethyl fumarate. It goes through an esterase conversion, and the active metabolite is monomethyl fumarate. Over here we have diroximyl fumarate. That's Vumerity. It goes through an esterase conversion, and the active metabolite is monomethyl fumarate. Then the direct molecule, monomethyl fumarate, is Bifurtim. So they were all FDA approved through, actually the first one was Tecfidera, dimethyl fumarate was FDA approved. Then Bifurtim and Vumerity were FDA approved through the 503B pathway, 502B pathway, getting all my things mixed up, showing bioequivalence of a medication. So they were FDA approved under Tecfidera's label or the dimethyl fumarate, the fumarate label. So those medications are available. They are all fumarates. And then back to the generic conversation we had earlier, generic dimethyl fumarate may be 10% more potent or 10% less potent. So the nice thing about the branded medications and the fumarates is we know you're getting the exact medication every single time, the exact same dose. So again, the Vumerity goes through an esterase conversion, and then the active metabolite is monomethyl fumarate, and monomethyl fumarate is FDA approved as Bifurtim.
So what are the efficacies of these different fumarates?
So they were all approved under the dimethyl fumarate label, being very effective in treating multiple sclerosis. So 90% reduction in new lesions, about 50% reduction in progression and relapses.
I was diagnosed 12 years ago, and I was doing great. I wound up getting no relapses or anything. I wound up getting COVID in July. I had all my boosters and everything else. They put me on, Pavlovic. Pavlovic. And from that, I haven't ever since then. My balance is bad. I can't walk anymore. It's down to one cane. I'm afraid to even walk out my front door. I feel like I'm starting all over again, and it's been very depressing. What do you recommend?
Unfortunately,
I had MRIs the whole week, and I even had my infusion yesterday too. So I've had 3 MRIs this week and my infusion.
unfortunately, this COVID has wreaked havoc on many people that have multiple sclerosis, and we're dealing with this overlay of what is post-COVID or COVID long hauler, what is MS, are they together, are they separate, and what can we do about it? And unfortunately, in the past 2 years, I've said I don't know in my career more than I ever have combined, because we're going to figure it out together. We're going to learn together. And if it was COVID that caused the problem, it might be time. It might be time and physical therapy and working on things to get back, because COVID has wreaked havoc on folks' immune systems, unfortunately.
Why would one choose bifiritim over another one of the fumarates?
Yeah, so one would be insurance coverage. So if your insurance covers one fumarate over another, you may choose that one. So bifiritim is great insurance coverage. Also, some of the other medications may have food restrictions, taken better with or without food or with less food. And so some may choose bifiritim because it can be taken with or without food, has good insurance coverage, and good copay assistance. And so that would be a reason to choose. There's no food interactions, and also no interactions with any medication. It doesn't decrease the effectiveness of birth control, which is really nice.
All right, thank you. I got more to ask you about bifiritim, but I've got something else to ask, and that is, the person wants to know what to do with hand tremors.
Hand tremors? Yeah, so a handful of things. It depends on what's causing the tremor, but we do have medications to help with tremors. We have beta blockers like propranolol. We have medications specifically for tremors like primidone. We can use medications like Topamax. So talk to your provider about it. And if it's bad enough, we might even send you to a movement disorder specialist to see if they have any other options, other things to help with the tremors. Also, occupational therapy can sometimes help. And then having adaptive equipment or weighted things. So if you have bad hand tremors, you might benefit from using weighted utensils or weighted pens and pencils to help that tremor, help weigh your hand down a little bit.
Okay, thank you. Next one from online wants to know if the bifiritim is counter-effective with the vaccines, or is that affected at all for COVID vaccines?
Really good question. So homework for everybody watching today, go to your provider and say, is it possible that my MS medicine has affected any of my vaccines? Either to decrease my body's ability to mount a response to a vaccine, do I need to get new vaccines for things other than COVID? Because some of the MS medications absolutely decrease the effectiveness of vaccines. And so and some of the medications, you absolutely cannot get vaccinated when you're on them. It's a contraindication. And I will say, oh gosh, please don't go get a vaccine that might go live and actually cause a problem. One nice thing about bifiritim is that it does not decrease the efficacy of any vaccine. It was studied in the fumarate family that there is 100% response to the COVID vaccine and responses to other vaccinations like Tdap, pneumonia, and flu. So back to that fumarate family, the fumarate family has been studied heavily in vaccination response, and they have 100% response to vaccines, and there's no reason why you cannot get vaccinated when you're on a fumarate. So if you are not on a fumarate, make sure you go to your provider, ask about your medicine, and does it decrease the effectiveness of your vaccines? And if so, then what do you do?
Great, thank you. This person has a lot of questions about fumarates, so I'm going to keep going with them, all right? And for one, she is doing family planning, and she wants to know if she could get pregnant using that.
So family planning is a great question to ask your provider. We are getting more and more information about family planning all of the time, and recommendations that we're making for disease-modifying therapies in multiple sclerosis, and if it's safe to be on your medication or not, and if it affects your fetus or not, or if it affects the immunity of your fetus. So fumarates have a really quick half-life. Bifiritim has a 12-hour half-life, which is why it's a twice-a-day medication. So it's in quick and out quick. So it's considered safe to be on if you're planning pregnancy. You can go ahead and continue the medication. medication up until you become pregnant, and then just discontinue it at that point. But good question to speak to your provider about with family planning and long-term medications. Will this affect my immunity long-term or not? And is this a good medication for pregnancy or not?
Are there any medications that you know about that are not good for having a child?
Yes, there are many that have warnings and labels associated with them. Many of the disease-modifying therapies actually have warnings associated with pregnancy. So good question to ask your provider.
Okay, and what about for those that are health conscious? They are, fitness buffs and whatever else. Are there any medications that are preferred over another for basically the same as family planning?
So one nice thing about fumarates is they're essentially a potent antioxidant. There's no medication interactions. They don't interact with any other medications for cholesterol, birth control, blood pressure, whatever it may be. So a lot of folks that are into fitness and health really like bifurtim for that reason, and the other fumarates for that reason, essentially a potent antioxidant. And they're working differently in the immune system than other medications. And then also it's important to look at the dosing and frequency of the medication that you're on. Is it convenient for you? Does it work for you? I always say to my patients, what are you willing to put in your body? If you're not going to give yourself a shot, it's not going to work. If the shot is sitting in your fridge, it's not going to work. If you're not willing to take a pill, it's not going to work. If you're not willing to do an infusion, it's not going to work. So let's choose a medicine that works for you. And oral medications have nice, because they're very convenient. You can take them with you, take them wherever you go. So if you are into traveling and those sorts of things, again, an oral option may be a really good choice.
All right, next one. Person wants to know they need to get an MRI, but they have a baclofen pump. How do they do that?
So you need to talk to the MRI facility and your baclofen pump team about if your baclofen pump is MRI compatible. Some are MRI compatible and it's not an issue at all. Others, we have to have a team there so we can turn the pump off for you to have the MRI, and then it's turned back on. So something to talk to your baclofen pump team about, as well as the imaging facility.
Okay, another person writes that they've heard about active MS versus non-active MS. Can you tell us about that?
So I feel like that's been lumped into so many different things. So some people view active MS as more inflammatory. Some people view inactive MS as less inflammatory. Some people say active MS only if you have a GAD-enhancing lesion. So it depends on what way you've heard about it, but in my mind, multiple sclerosis is active if you're having symptoms of multiple sclerosis, and even if you are in remission and not having symptoms of MS, you still have active MS because your body's own immune system is still seeing your myelin as foreign. So it's foreign, it's actively going and attacking it there. And so I think this active has been thrown out in so many different ways, but those are the different ways that I think about it. But even if it's inactive MS, you still have MS that can still absolutely be causing you symptoms of multiple sclerosis.
Okay, thank you. Next one. What cannabis lotions to use for pain or even legal therapies? I know different strains help in different ways.
So I am from the state of Utah, so I have to follow, in order to keep my cannabis prescribing card, I have to follow my rules and regulations in Utah. So in Utah, I cannot make a recommendation for dose frequency and type. That would be a question for the pharmacist at the dispensary with what types they have found work best for MS patients. And there are many different options available topically and orally that they can try.
Thank you. Next one from Maria. I take the generic dalfampridine because my insurance won't cover Ampera. Is the generic okay, or is Ampera better?
So dalfampridine is one of those that I actually am okay with you doing a generic if it's affordable. And also, I just found this out through Mark Cuban's pharmacy. They have generic dalfampridine available for $11.60. So it might even be cheaper just to order through his pharmacy. And again, I make no money on that. It might even be cheaper for you to go through his pharmacy than even run it through your insurance. But absolutely, I think generic dalfampridine is okay. We can even compound it if we need to. Again, it's a symptomatic medication for the symptom of MS, so I'm okay with the generic formulation of that one. And you can get it cheaper sometimes if you cash pay, go through Mark Cuban's pharmacy or get it compounded.
What can you tell us about cannabis versus CBD?
good question. I can answer that. So, cannabis is made of a handful of things. So we have CBD plus THC. Now, CBD is what actually is treating the pain. It's working on the receptors. THC is what everybody was smoking in the 70s when they wanted to get high. So THC is what causes the psychogenic effect of cannabis. But what's interesting, so you say, well, why don't I just use CBD? In order to open up the pathways for the CBD to go in and do its job, you have to have enough THC to open up the pathway. THC opens up the pathway, CBD goes in and does its job. So when we're treating multiple sclerosis, we're trying to find a balance between enough THC to open up the pathway for the CBD to go in and do its job, but not too much THC that then you're getting high. So if you're putting it on topically, it is THC plus CBD, and it goes in, helps open up those pathways. So good questions to talk about with the pharmacist at the dispensary.
Going further with that, I personally know that there are different strengths. There's the 1-to-1, 2-to-1, 3-to-1. Can you elaborate on that, please?
Different for everybody. Some people absolutely need a 1-to-1. Some people need 60-40.
No, just explain what it means.
Oh, the ratio means how much CBD to how much THC.
Okay, thank you. All right, and why would they get 3-to-1 versus 1-to-1?
So if they're more sensitive to the THC, they might find that they need just a drop of THC for the CBD to go in and do its job. Or they may find they need more THC to open up the pathways for the CBD to go in and do its job. So it's very individual. Many people with MS find they need a 1-to-1. They need half CBD, half THC. Some people find that they do a 1-to-1, but then they take extra CBD, and that works for them. So everybody is different there in their receptors.
Yeah, and I need to let everybody know that just be careful with if you trust or if you do any of these, because you could go to different cannabis dispensaries and they have different strengths. You think that you're getting the same thing from one to another? No, and you could get the crap knocked out of you if not taken correctly.
Yeah,
and that
exactly.
is a personal note. Okay. All right. Next question. What are the MS treatments that do not deplete the B cells? Did we say that already?
So to make life easier, I'll say the ones that do deplete the B cells. So Rituxan, Ocrevus, and Kesimpta deplete the B cells. The rest of them are not B cell depleters.
Okay. Ruth says to tell you, thank you for a fantastically outstanding presentation again.
Thank you, Ruth.
Okay. All right. Next, Mary online. Can you talk about swallowing issues and speech issues that come up occasionally?
Yeah, so a few things with swallowing. If you're having trouble swallowing, we can do two things. First off, again, it might be because you are a human. So swallowing issues might be because there's something going on with your esophagus. There could be thickening in your esophagus. You could have a Schlotzsky's ring. There are other things going on there. You could have heartburn that has caused trouble in your esophagus. So then it's thick and it's built up so you can't swallow. So for those things, I would send you to a GI physician. They would do an endoscopy and most likely stretch your esophagus out. If it's not a GI issue, then we can send you to a speech therapist. They can do a swallow study to see what's going on. Is it trouble with your brain communicating down to swallow? And then what can we do about it? And the speech therapist can really help with that. You might need thickened liquids. You might need to chew your food differently. You might need to tuck your chin when you swallow. But multiple sclerosis can cause those problems, absolutely. We don't want you to aspirate and get things in your lungs. So if that's something you're having trouble with, talk to your provider, because we might need to send you to speech therapy to work on how to swallow correctly.
Do any of your patients take naltrexone?
Oh, absolutely. I have patients that take naltrexone. So what's interesting about naltrexone, low-dose naltrexone, there's no studies to say that it treats MS. So if I have a patient on naltrexone, I also like them to be on a disease-modifying therapy. But there is data in regards to low-dose naltrexone and pain, fibromyalgia pain specifically. And a lot of people that have MS have a fibromyalgia pain overlay. It does look like naltrexone on the cellular level decreases cytokine production, which is an inflammatory cell or inflammation. So I use naltrexone for the treatment of pain quite often, but it is one of my may-haves, not one of my must-haves. So if somebody's having pain, we wonder if they have fibromyalgia, we'll try some naltrexone. If it works for them, fantastic. If it causes side effects or doesn't work, then we don't take it, but can really help with pain specifically.
Great, thank you. Last question. Person asks, in your experience, does Banner Life Science offer financial assistance programs for patients? And can you elaborate on all of that?
Yeah, so Banner Life Sciences is sponsoring me being here today, hence why a bunch of questions about Banner specifically. This is a newer medication. A lot of people haven't heard about it. They have excellent copay assistance, excellent programs to help patients. Patients are getting the medication in their hands very quickly, and the company has been fantastic to work with for my patients. They've been very pleased. So back to the beginning when I said, look at what MS medication you have and call that 1-800 number. Banner is available. People will answer the phone and they can help you get your medication and then have other assistance associated with that.
Great, thank you. Thank you, Katrina. Thank you for being here. We've never had Katrina speak for us before, and I cannot wait to bring her to different locations around the country. It will be fabulous. I think people will be very happy with her. All right, so I just want to sum things up real quick. First off, I want to thank everybody that is here in attendance, and this is great. I can't wait to do this again in this area. And again, thank you, everybody, and say goodnight and goodbye to everybody around the world. Thank you very much. Have a good one. Bye-bye.